Thank you for joining me, Mr. DeLange. Can you walk me through the opioid settlements that Idaho went through this year?
Well, we have a number of settlements. The ones that are most present right now are with what we call the three large distributors and Johnson & Johnson. And they're two separate settlements, but they're the ones that right now we've reached settlement agreements with, and we're obtaining participations around the country and in Idaho. Collectively, they are nationally, they're over $25 billion. Idaho's share can reach $120 million if we get all the participation we need. And so they're robust settlements and have the opportunity to do a lot of good for our state.
Yesterday, Thursday evening, a federal judge tossed one of the settlements in connection to the Sacklers. Can you explain to me what that means and how that affects the funding we may get?
Sure. It's a totally separate settlement from the two I just talked about. We had reached tentative settlement with Purdue Pharma and the Sackler family as part of their bankruptcy. It's a fairly arcane bankruptcy legal issue about whether in a bankruptcy proceeding with a company, can the judge immunize individuals that aren't part of the bankruptcy? And the bankruptcy judge said yes and issued an order immunizing members of the Sackler family. The first instance of appeal, the district court judge said, no, you can't do that under the bankruptcy code. So obviously Purdue will appeal to what's called the Second Circuit Court of Appeals, and I'm sure whichever side does not win will probably appeal to the United States Supreme Court.
For listeners that don't know, the Sackler family owns Purdue. Purdue is the company that created OxyContin.
Correct.
Yeah.
We filed a separate lawsuit in Idaho specifically against Purdue and the Sackler family for what we allege to be many violations of Idaho law. And that settlement and that litigation is separate from the settlement we're talking about here, but it has to do with the direction and management that the Sacklers undertook in marketing what we allege to be misrepresenting OxyContin and its uses and availabilities.
Can you tell me a little bit about the funding that we are getting and if there's a timeline on that yet?
Yes, there's a number of timelines. The next timeline is January 2nd to find out if there's enough participation by eligible local governmental entities. And in Idaho, we have virtually 100%. We're pleased with that. We're way ahead of the game compared to some of our other sister states. But at that point, then the defendants decide if they have enough buy-in to the settlements to proceed with it. If everything goes according to plan, and of course in litigation like this, virtually nothing goes according to plan, but if everything does go according to plan, we could see our first payments potentially in April of next year. It's possible that will slip, but we're ready, and we're hopeful and optimistic that settlements will proceed as planned. And
what can that money be used for?
The settlements are very specific. Money received, whether it's the state of Idaho, whether it's our individual local governmental entities, or whether it's the regional health districts, have to be used for what's called Exhibit A projects. And Exhibit A, these settlements are long. They're like 300 pages long, but sets forth in 10 pages the types of opioid remediation projects that are acceptable to spend money on, whether it's withdrawal treatment or addiction treatment or education or buying medicines for first responders to utilize with someone who's overdosing. So there's a variety of projects that participants who are recipients of the money will look and say, well, we'd like to do this. Yep, that fits within Exhibit A, so we can spend it. Then there's a reporting requirement at the end. But we're optimistic. We spent a lot of time talking to public health experts about the types of things that would make a difference in remediating the opioid crisis that we see in our state and we see around the country. And so these things are set forth in that exhibit.
Rosie, I want to kick it over to you. Can you talk to me a little bit of about what the landscape of treatment is in Idaho and what individuals suffering from opioid use disorder face when trying to seek treatment?
Sure. When the opioid epidemic first really hit Idaho hard several years ago, our department went out and implemented a pretty robust system of what we call medication-assisted treatment. It is considered the gold standard for individuals addicted to opioids. Just psychosocial treatment plus medication tends to have the best results. So we have done a lot of work in the state over the last several years to both pay for medication-assisted treatment, but also expand. We just this year will be opening up 3 new opioid treatment programs, which up until now we've only had 4 in the state, and they've all been in the Treasure Valley. These 3 are outside of the Treasure Valley. We also have opioid-based office treatment programs that we're trying to expand and just improve access for individuals who suffer from the disease of opioid use disorder. There are also a lot of other things needed in our system that beyond just treatment. Recovery housing is a big thing, transportation. We have started a handful of programs specifically targeted towards opioid, including what we call emergency department warm handoffs. So what that is an individual appearing at the emergency department with an opioid overdose. That happens all the time in Idaho, and frequently the medical people save the person's life and then they release them. Right, that is a really high risk time for overdose again. What the warm handoff program does is a recovery coach, a trained recovery coach, will meet the individual in the emergency room, and so when they discharge, they are connected to someone who can then help them connect to treatment and other recovery supports. That's just one of the programs that we've just launched. We've got it in pilot status, and hope to expand that. A little bit of a challenge because our hospitals are busy with COVID, and trying to implement a program like this has been a little challenging. We have several other programs that we're launching. We have a reentry program for women who are discharging from the Pocatello Women's Correctional Center. Again, similar concept, get them on MAT if they want it, connect them with recovery resources in hopes of reducing recidivism. We've been distributing naloxone statewide for first responders or other agencies, and the requests for naloxone, the drug overdose reversal drug, have really increased a lot. We've got a lot of different activities, and also prevention. Money goes over to the Office of Drug Policy and the Boys and Girls Club, and education. So we've been funding University of Idaho Project ECHO in hopes of educating more practitioners in the treatment of this disease.
What could this additional funding coming from the settlement that local governments can apply for, what does that additional funding do for treatment? What does the Division of Behavioral Health see that?
Well, it really helps a lot. Medicaid expansion, we get a certain amount of block grant funding every year. So previous to Medicaid expansion, we were spending the majority of that funding on actual psychosocial treatment for individuals, and we never had enough money to meet the need. With Medicaid expansion, a large majority of the individuals we previously served are now getting their treatment met through Medicaid, and we're able to backfill with transportation, housing, et cetera, and then also some of these system improvements. So all of these things that I mentioned and more, workforce development is a huge gap, the behavioral health workforce in Idaho and in the nation. So we need to put some effort into having the workforce to treat these folks. So more money means we can expand more and faster and improve access, especially in more of our rural areas. That's where we're lacking a little bit.
That's what I was going to ask you next is, are there areas of the state that struggle most with having treatment options or assistance? Some of the assistance that you mentioned. I
think just because of the nature of medication-assisted treatment, having access, with methadone, for example, in the beginning, it's a daily pickup. I have to go in every day. So if it's rural, that makes it a little bit more challenging. However, under COVID, the federal government has given us they've relaxed the rules a little bit so people can have week-long take-homes and such. We are expanding telehealth, trying to reach more people that way. And so, yeah, the rural nature, as with other services, it is more challenging, but it doesn't, we still are trying that. We also give funding to, Idaho has 9 recovery centers in the state, and several of those are starting to have satellite centers. So the Boise Center, for example, has satellite services in Cascade now, and trying to promote more of that, boots on the ground, really getting out to these smaller communities. We've also been partnering with several of the tribes in the state.
Mr. DeLange, what is the next step moving forward to make sure this money is allocated to areas of the state that need it?
Well, Idaho, one of the things that General Wasden directed is to negotiate how this money is going to get allocated in a fair way. And we ended up with an allocation agreement where 40% of the shares will go to the state, 40% will go to our local governmental units, and 20% will go to our regional health districts. All of them, again, have to be spent on opioid remediation approved projects. The next step is for the defendants to determine whether they have sufficient participation by local governmental entities. And if they do, then the next step is the money gets deposited in accounts. Our legislature was proactive in this regard. In the last session, created what's called an opioid settlement fund, where any opioid settlement monies will get deposited into to be used for opioid remediation purposes. So that's happening at the state level. And so that's kind of where we're at now, is we're waiting for that January, I think it'll be January 16th when we hear from the defendants whether they believe there's adequate participation nationally to proceed with the settlements.
What parallels do you see between this settlement and the settlement that Idaho saw years ago with the tobacco companies, which established what's now known as the Millennium Fund?
Yes. I'm kind of proud of what our state's done compared to other states. Idaho created the Millennium Fund and then every year when we get our settlement monies, it goes into that fund. And then the legislature appropriates money for a variety of public health related purposes, whether it's the meth project, youth courts, tobacco cessation program, education. And so we've had a model, and it's worked for our state. And that money is protected. In fact, maybe it's been about 10 years ago, they constitutionalized 80% of that fund. So it's in there, and you can't legislatively take money out of it and use it to, fix a pothole, if you will. So that's a model that the opioid settlement fund that was created by the legislature, the legislators in the state and the governor and General Wasden have to look to go forward. It's interesting, both of these cases involve highly addictive substance that because of their addictiveness creates problems for our citizens, and that ultimately end up creating, the sort of tragedies that we've seen, with death and overdose death, cancers, and so the focus is trying to, with these settlements, is how can we help remediate? We don't want to create a false expectation. These settlements are not going to solve the problem of the opioid crisis in Idaho, just like the Millennium Fund hasn't solved the problem of tobaccos, but they're important tools that hopefully will be utilized in a way that makes things a little better than what they're at now.
Rosie, in 2021, unfortunately, nationwide, there was an increase in overdose drug deaths. Some of those involved opioids. What can Idaho proactively do to help prevent that?
Wow, that's a tough question. That's the million-dollar question. I think right now, again, it's education and prevention, and we've made strides a lot in terms of prescribing practices and educating physicians, and we have data to show from the prescription drug monitoring program that our prescribing practices are much better than they used to be. However, today's problem isn't so much the OxyContin, it's fentanyl. And that's where we're really seeing a lot of the overdose deaths and getting reports from law enforcement, both right across the border in Oregon and here in Idaho with a lot of counterfeit fentanyl. And while we're lagging in data a little bit, we're still in 21. We do know that nationwide, we topped 100,000 deaths last year during the COVID epidemic. That's not just true for opioids. We have data showing that purchase of tobacco and alcohol and everything has gone up during the pandemic, and that doesn't surprise us. Unfortunately, now with the influx of fentanyl, it's deadly. So unfortunately, I think the biggest thing we could probably do is, wow, there's so many things that need to be done, but to stop the death, I would think we should focus on fentanyl. To start getting people healthy, I think we need to focus on reducing stigma and not judging folks because they have an addiction, and really improving access and letting folks know it's okay. This is not a shameful thing. You have an addiction, you have a disease, and there is help. And there are people in recovery ahead of you that can help pave the way. So I think those two, if I had to narrow it down to two, there's just a lot that we need to do.
Sure. This is a story we'll continue to follow as Idaho allocates the funding from the settlement fund, but I really appreciate your time and thanks for joining me.